Okay, so today's lesson, everyone, is about health and sickness, something that we are all going to have to experience in our lives, something that we all need to be able to talk about. So here we go. So again, we acknowledge and pay respect to the past, present, and future traditional custodians and elders of this nation, and the continuation of cultural, spiritual, and educational practices of Aboriginal and Torres Strait Islander people.
Sorry. Health
So
and
health
sickness.
and sickness. So first of all, we're going to start with some useful words and phrases. So I'm going to just say the words, and then as we go through, we'll get people to have practice reading them, but we'll move through a little bit and see how we go. Okay. So just listening to me say them, and then you'll be able to say them as well. So doctor, general practitioner, or GP, dentist. Mariam, Panahi, can I get you to switch your mic off, please? Thank you. Dentist, optometrist, nurse, hospital, clinic, medical center, appointment, chemist or pharmacy, prescription. Okay, we'll go to the next one.
We will. Sorry.
That's all right. Sickness or disease, injury, to suffer from, to be treated, medicine, drug, medication. These are all words for similar things. Advice, vaccination, injection or shot, blood test. Nazia, can I get you to please put your mic off? Thanks. Okay. We'll go to the next one because we'll move through and then we'll come back to get people to read. Thank you.
Oh, sorry. I thought we'd just
Okay. Okay. So here we have pain, painful, sore, ache, aching, tablets, pills, vitamins, cream, ointment, cough mixture, lozenges. So these are all words for a lot of those words from about tablets down are for things that will help us when we're sick. So, yep. Okay, so what we might do is we'll do this one and we will get someone to read this. We might go back and get people to read the others in a minute, but this one shows parts of the body. Very important to know parts of the body when we're talking about health, because if you go to the doctor, we need to be able to tell the doctor what is hurting on our body. So here we have a head, neck, shoulder, chest, stomach, elbow, arm, hand, finger, thigh, fingernail, calf, knee, heel, toe, foot, toenail. Actually, we might go to the next one and just have a quick look at what that next one is. Okay, so here are some phrases, and these ones I think I will get you to say someone to read these, but I will read them first and then I will get someone. These are some phrases that we might say if we are in the doctor. So, I am sick, I am not well, or I don't feel well, I am ill, I have a headache, I have a migraine, I have a stomachache, I have a backache, I have an earache, I have a sore throat. Okay, so I'm going to ask, I think we were up to Rahila. Rahila, are you there? Rahila? Okay, Mastora. Mastora, are you
Yes,
there?
ma'am.
Is that Rahila or Mastora?
Yes, yes,
Who is it? Is it Rahila or Mastora? Can
yes.
you just say your name? Okay. Anyway, uh,
Rahila is
I,
no
I
longer
can't
nude.
see the whole thing. So who
Yeah.
just put their hand, who's speaking? Do you know?
But well, Rahila is available now.
Okay,
So
Rahila, can I get you to read these out?
Yes. What's
Please.
wrong with you?
Yep, keep reading.
I am sick.
Yep,
I am not well. I don't feel well. I am ill. I have a headache. I have migraine. I have a
ache,
stomach,
stomach ache.
stomach. Yes, stomach.
Yep,
I have a backache. I have an headache.
yep.
I have a short
Okay. So
throat.
let's go, let's try a
Yes,
couple of
yes.
these.
Short throat.
You need to listen. So see the one where it is I have a migraine. It is I have a migraine. Migraine is a
Uh-huh.
very, very bad headache. Probably the man in the picture here, the person in the picture, he has a migraine. He's holding his head. It's very painful. Okay, so when the word ache, it means like it hurts a bit. It hurts. So
Stomach.
all these parts of your body are hurting, stomach, back, ear. And then with your throat, that's the throat is the bit that's inside your neck. And when that is hurting, sometimes when you can't swallow or you have a cold, we say that's a sore throat. Okay, but thank you. Good reading. Good work. Okay,
Okay,
thank
thank
you,
you,
Sheila.
ma'am.
Okay, next person. Sorry, next slide. So some more things that we can say if we're not well. You go to the doctor and you might say, I have a cough. I have a cold. I have, I feel dizzy. I have the flu. The flu is a short for abbreviation for influenza. Um, I have COVID. We all know that. That's a terrible thing. We've all been going through that. Um, I have a fever. I have a blocked nose. Um, I am sneezing a lot. Okay, so I will now ask Mastora. Are you here, Mastora? Mastora? No. Okay. Zarifa. Zarifa, are you here?
Yep. Yes, ma'am.
Hey, Zarifa, can
Which
I get you?
Zarifa? Ma'am, Zarifa Muhammadi or Zarifa Hussain? We have two
Okay,
Zarifa.
Zarifa, can I get you to
Okay.
read, please?
Okay, what's wrong with you? I have a cough. I have a cold. I feel dizzy. I have the whole influenza. I have a cold. I have a fever. I have a blood. I am sneezing a lot.
Okay, I want you to try and say two things for me. Can you say cough, cough,
Yes, cough.
cough? And can you say fever, fever, fever?
Fever?
Perfect. Good work.
Okay.
Okay, just practice those two, but otherwise, lovely reading. Okay, go to the next one.
Okay, thank you, ma'am.
No worries. Okay, more things that might be wrong with you when you go to the doctor. Gosh, so many things. So what's wrong with you? You're in the doctor. So you could say, I have a broken leg, or a broken arm, or a broken finger, or a broken toe. I have sprained my ankle or my wrist. And if you look at the picture of the body that we looked before, you would be able to see where that is. But you can see where your wrist is. It's part of your arm, right? Your ankle is part of just the bit that comes just above your foot on your leg. So I have concussion. I have diarrhea. I am constipated. I feel nauseous. I have vomited. I feel tired. So I'm going to explain a few things here. If you break something, then that's all the parts of the body that could be broken, your leg, your arm, your finger, your toe. Sprain means that you haven't broken it, but you twist. You might have twist your leg or you twist that part of your arm. And we call that sprained. And it really hurts, but you haven't broken the bone. All right. Concussion is like if you fall and hit your head or you hit your head on something, you then might get a concussion, which means you lose consciousness a bit. I have diarrhea. That's when you go to the toilet a lot and it's very uncomfortable. You get a stomach pain and you have to keep going to the toilet to yeah, and it's not cool. Can you
It's
describe it any
very,
better, Jade?
yeah, and it's very liquid as well.
Oh, it's very runny.
Yeah,
Yeah, liquid.
yeah,
Yeah,
yeah.
it's not nice. And it's not when you go to urinate, it's to do the other thing. It's when you go to defecate. We call it defecate, when you pass a stool.
And
I
sometimes we call it a bowel movement as well. That's
Oh,
the
that's
other.
true. We do. We call it a bowel movement. Yeah, that's good. Yeah, I forgot. And then I am constipated is when you cannot go to the toilet. So you might feel like, oh, I really want to go to the toilet, but I can't. My stomach is hurting, but I can't do a bowel movement.
Sort of
And then
can't push it out.
you
Yeah,
can't, yeah. And then I
yeah.
feel nauseous is when you feel like you might want to be sick, you might want to vomit. And then I have vomited is when you actually do vomit. That means uh you are vomiting things out of your mouth. Yeah, the food is like you have eaten something bad, or you might be sick with a bug, with a illness that makes you vomit. And I feel tired. You might go to the doctor and say, I just feel very tired. I don't know why. Okay. So I'm going to now get Maboba. Maboba, are you here?
Yes, sure.
Maboba? Okay, my dear. Can I get you to read these ones out for me, please?
Should I read?
Yep.
Thank you. Hello to everyone. Sorry. Uh, what's wrong with you? I have a broken leg. Or we can say I have a broken arm, broken finger, or I have a broken toe. Then I have a sprained. Should I write? Is it right? Sprained?
Yeah, you're doing very well.
Uh,
I have sprained my,
yeah. I have
yep,
sprained my ankle or
yep,
my wrist.
good.
I have concussion. I have
Concussion.
concussion. Yeah, thank you.
Beautiful, beautiful. Thank you.
Thank you. I have diarrhea.
Diarrhea. It's a very strange word, spelt in a very
Okay, it's
strange
a
way.
silent. Yeah?
Yeah, it's
Diarrhea.
diarrhea. That's how you say
Yeah,
it. Spell it. Yeah? Okay.
I have diarrhea. Yeah, thank you. We can say I have or I'm constipated.
Beautiful.
Constipated.
Good.
I feel nauseous.
Good.
Nauseous.
Yep,
I
that's
have vomited. Vomited.
good.
I feel tired.
They were hard words. You've done really well. Well done. Thank you,
Oh,
Maboba.
thank you. Thank
Okay, let's
you.
go with the next one.
Thank you.
Good. Next slide, please. Yep. So, some more things. And let's go with some even more problematic things that might happen to us. Okay. So, what's wrong with you? I have menstrual pain, or you might say, I have period pain. I am bleeding heavily. I have a urinary tract infection or a UTI. I have gastro, which is short for gastroenteritis. In Australia, we tend to always just say gastro, which is basically when you have a flu in your stomach, makes you want to vomit, it makes you get diarrhea. It's very yucky. Okay, it's not nice. I have a rash. I have an allergy. I have a bruise. I have a burn. I have a cut. I have a wound. So let's go through some of these. I have menstrual pain or I have period pain. Now we're all women here, and all of us have had our have been like if we're of a certain age, we have menstruated, which means we bleed every month. And many women, including me, when I was getting my period, we get a lot of pain, and you might go to the doctor. You have pain in your stomach from
But
getting
not everybody does, because I didn't
no,
have very much
but
pain. I'm
but like
just,
heaps of women have it,
yeah,
heaps,
yeah, yeah, yeah. No, it's
heaps.
important to say it.
It's
Yeah,
really heaps. Like I mean, like so many women have it, and I think at least a lot of women will, even if they don't have really bad pain, they have discomfort or heaviness in their stomach at that
yeah.
time. And we have to acknowledge that this is a big thing we do every month, and it is not comfortable for most of us. It's not comfortable, but
It's
you
hard
might.
to
If
be
you
comfortable having the bleeding all the time. That's for
no,
sure.
it's yeah, and some people need to go to the doctor for that. So sometimes you might go to the doctor because you're bleeding heavily. A lot of blood is coming, and you're worried. The other one that a lot of women get, and men, but mainly women, is a urinary tract infection, where we get an infection in where we are urinating, and that's called a UTI. That can be very painful and make you feel very sick. So you might go to the doctor and say, it hurts a lot when I go and do a urination, like, pass water, and it's not good. Um, and it might hurt, and you might get a fever, and then you tell the doctor. I have gastro that I told you. It's the stomach flu. You get vomiting, you might get diarrhea. I have a rash, which is like when you get like a red lumps on your skin, and it can be very itchy. I have an allergy. Sometimes if you touch something or you eat something, it might cause you to feel sick, or it might cause you to have this rash. That means you are allergic to that thing, and that's an allergy. I have a bruise. The person in the picture, that arm, that is a bruise. When something hits you but doesn't bleed, but you get that mark on you. I have a burn when the fire, or you touch something very hot or hot steam, and you can hurt yourself. That's a burn. I have a cut. You cut yourself with a knife, or you might fall over and cut your arm or your leg. I have a wound, which is like when your skin is broken and it hurts a lot and sometimes takes a little while to heal. That's a wound. So I'll get Manaz to read. Manaz? Manaz, are you there? No? Okay, Mursal. Mursal? Mariam Ayobi. Mariam Ayobi, are you here?
Sorry. Yes,
Yeah, Mariam? Okay, can I get
yes,
you to read, please, Mariam?
of course. Thanks.
Okay.
What's wrong with you? I have menstrual pain or I have period pain. I have bleeding heavily. I have urinary tract infection or UTI. I have gastro or gastroenteritis or stomach flu. I have a rash. I have an allergy. I have bruise. I have a burn. I have a cut. I have a wound. Is it
Beautiful.
finished?
Thank you. Nice reading. Good. Hard words
Thank you.
there. Did well. That's good. Okay, next slide. Okay, so here we're going to get someone to match the words on the left, the sentences on the left. So you go to the doctor, you might say these things to the pictures on the right. Okay, and the person, so we've got my finger hurts, my eye hurts, my foot hurts, my toe hurts. Okay, I am going to ask Sultana. Sultana Tay, are you here?
Hello everyone. Hello dear ma'am. Yes.
Okay, Sultana, can you match these things to the pictures? My finger hurts. Which
Yes.
picture?
Yes, sure. What hurts? My finger hurts. Number 2. My eye hurts. Number 4. My foot hurts. Number 3. My toe hurts.
My toe.
No, sorry, my toe hurts. It's number 2. And my finger hurts. It's number 1.
Yay, I knew you would
Good
self-correct that. Well
correction.
done,
Yes.
Sultana. Good work. Okay,
Thank
sorry,
you.
next slide. Okay, we'll go to the next
Should I?
slide. No, the slide before. Yeah. So I'll get someone else. So this time I will get Nargis. Are you here? Nargis Azizi? Okay, Fahima. Are you here, Fahima?
Yes, ma'am. Hello, how are you?
Okay, can I get you to match this? I'll read them out first and then you will match them. My neck
Sure, ma'am.
hurts, my leg
My
hurts. Wait, my arm hurts, my hand hurts. Okay, you've got to match now.
okay,
Go.
ma'am. My neck hurt, number 4. My leg hurt, number 3. My arm hurt, number 1, and my hand hurts, number 2.
Beautiful. Perfect. Okay, so we can see all the parts of the body that are hurting. Good. Next slide. So now let's go. We've gone to the doctor. We've told the doctor all the many things that are wrong with us. And now let's see what the doctor might say if we go to the doctor. So here are some phrases from the doctor. Let me examine you. Let me check your eye or your ear or your throat. Let me take your temperature. Let me take your blood pressure. Please lie on the examination table. Let me feel your pulse. Let me listen to your heart. I will organize a blood test. I will write a prescription for you. So most of these are you might know from going to the doctor, but the prescription is what the doctor writes on a piece of paper and then you take it to the pharmacy, all right? But we'll get someone to read these doctor's phrases out and that person will be, so Fahima, you just did one, didn't you? So we'll do Sweeta. Sweeta Yobi, are you here?
Yes.
Hello. Can you read me out the doctor's phrases, please?
Okay. And Dr. Face, let me examine you. Let me check your eye, ear, or throat. Let me take your temperature. Let me take your blood pressure. And please lay one of examination table. Let me feel your pulse. Let me listen to your heart. Let me organize a blood test. I will write a pres prescription for you.
Good. Okay, but let me go back and say, can you say the word blood? Blood? Here, where let me
Yeah.
take your blood pressure or I will organize a blood test.
I will organize a blood test.
Good. Okay. And then blood pressure is when the doctor takes your blood pressure with the blood pressure cuff. And then your pulse. Your pulse is that little kind of thing where the doctor might hold your wrist to feel how your heart is beating. Can you say the word pulse, please?
Let me feel your pulse.
Beautiful. Okay, good. Thank you. Good work. Okay, go to the next one. All right, we're going to do a little dialogue. And so Jade and I are going to do this. So then I will get some people to do it for us. So I'll be Miss Idris and you can be Mariam Jade. So Yusuf is not at school today. Yusuf's teacher, Ms. Idris, asks Mariam about her brother. Remember, Mariam is Yusuf's big sister, older sister. Mariam, where is Yusuf? Why isn't he at school today?
Yusuf is sick today.
Oh, I'm sorry to hear that. What's wrong with him?
He has a cough and a fever.
Has he been to the doctor?
Yes, Dad took him yesterday. The doctor said it's not very serious.
Does it go to another slide, Jade? I think it might.
Yeah.
Yeah. Okay, we'll go to that one. Did she give him any medicine?
Yes, she did. She said he had to take cough mixture and Panadol if he has a headache. He has to rest and drink lots of water.
I hope he gets well soon. Okay, so let's go through and we'll go back to that slide and we'll get two people to read. So, Sumaya, are you here? Sumaya?
Yes, ma'am, I'm here.
Okay, good. Sumaya, I'd like you to be Miss Idris, the teacher.
Okay.
And Masa, are you here, Masa?
Yes, mom, I'm here.
You can be Mariam. Okay, go.
Yes, okay. Okay, Yusuf is not at school today. Yusuf, teachers Miss Idris asked Mariam about her brother. Mariam, where is Yusuf? Why isn't he at school today? Sorry, mom, one moment.
Sorry, can you do it, Masa? Okay, well, we're just waiting because I'll have to get someone else. Okay.
Mom, can I read?
Yeah, Sarah Gahari. Are you here?
Yes, ma'am.
Okay, Sarah, can I get you to be Mariam, please? Go.
Sure.
Yep. So Yusuf is 16. Yep, go.
Mariam, where is Yusuf? Why isn't he at school today?
Yusuf is sick today.
Oh, I'm sorry to hear that. What's wrong with him?
He has a cough and fever.
Has he been to the doctor?
Yes, and that took him yesterday. The doctor said it's not very serious.
Okay, next slide.
Did she give him any medicine?
Yes, she did. She said he had to take cough mixture and Panadol if he has a headache. He has to rest and drink lots of water.
I hope he gets well soon.
Good reading, guys. So I was just wondering here, and I'll get one of you to answer the question at the bottom of the thing.
Okay.
So other names for Panadol are Tylenol, which is, so Panadol, you take it if you've got headache or you feel a bit unwell or you feel a bit, if something is hurting on your body.
And
And Tylenol is also a brand name, and paracetamol. And I don't know what that other thing is, but anyway.
acetaminophen. So yeah, so Panadol and Tylenol are the same thing, and paracetamol and acetaminophen are the same things. I think we say paracetamol, don't we? And I think
We
America
say
says
Panadol. I basically say, yeah, Panadol, and Panadol for me, it's like paracetamol.
and Americans say Tylenol.
Oh, okay.
Yeah.
What do
And
you?
paracetamol and acetaminophen are the names for the same compound. So they're 4 different names for all of the same thing.
Okay, so they're all the same drug. But what
They're
do
all
you
the
call
same
it in
thing.
your culture? Can one of you answer? Maybe, Sarah, can you tell us? What do you call it? Do you have this one in your culture, in your country? This medicine?
Yes, we will use medicine.
Yeah.
And drinking a lot of water.
And do you call it Panadol? Do you have Panadol? Or do you have a different medicine?
Maybe.
Answer me.
Okay. Well, we can come back to that question later. We'll go to the next slide.
Teacher, can I say?
Yeah, sure. What?
In Afghanistan, we say paracetamol.
Oh, good. Paracetamol, good.
And in Iran, people say acetaminophen.
Ah, That's very
interesting.
good. Thank you.
Yeah.
That's very interesting. Good information. I did not know that. That's great. Thank you. Okay. Okay. Next slide. Okay. So we have a slide here where we have Paul visiting Dr. Wenmei. So Dr. Wenmei, Jade, you can be Dr. Wenmei, and I'm happy to be Paul.
Okay. Good morning, Paul. What's wrong with you today?
Hello, Wenmei. I have a stomachache and a fever. Barbara thinks I might have gastroenteritis. She says it is going around at the moment.
Are you feeling nauseous?
Yes,
Have you vomited?
yes. Can you go to, yeah,
How many times have you vomited?
twice. I also have diarrhea.
Let me take your blood pressure and check your temperature. It looks like Barbara is right. She was my lecturer at university. I learned a lot from her.
She made my appointment with you. She said you were a very good student.
Take Panadol for your fever, drink lots of water, and stay in bed until you are better.
Okay, so we might get two people to read this, and they will be Suraya Sultani. Are you around?
Yes,
Suraya?
teacher, I'm here.
Fantastic.
Yes,
Okay, you can be the doctor.
yeah.
And Nazifa, are you here?
Yes, teacher, I'm here.
Great. Okay, you can be Paul. Okay? All right.
Okay.
Let's go.
In the name of Allah, good morning, Paul. What's wrong with you today?
Hello. With me, I have a stomach and a fever. Barbara thinks I might have stomatitis. She said it is going around at the moment.
Yeah. Are you feeling nauseous?
Yes.
Have you vomited?
Yes.
Yeah. Okay.
Okay, do you want, yeah. Okay.
Yeah. How many times have you vomited?
Twice. I also have diarrhea.
Diarrhea. Yeah. And let me take your blood pressure and check your temperature. It looks like Barbara is right. She was my lecturer at university. I learned a lot from her.
She made my appointment with you. She said you were a very good student.
Yeah, and take Panadol for your fever. Drink some
Sorry,
water.
Yeah.
It's finished, teacher.
Thank you. And stay in bed until you are better. Good. Okay, good reading. And so now we can see that one. I just wanted to check a word there. What was the word, Jade? Did you pick it up?
Yes, there
It
was.
Well, diarrhea, you did very well,
Oh.
but the other one was gastroenteritis. That's right.
Oh,
So
and
we
what about
might need to do,
twice?
yeah,
What about
twice.
twice?
Yeah, yeah. So twice. Just remember, guys, like students, when you hear that word, it's twice, okay? And then in the slide before, we have this word here, gastroenteritis. Sometimes they might just say gastro, which is much easier. But so Paul has the stomachache thing, right? The stomach bug, something going on in his stomach. Okay, thank you. All right, we'll go to the next one. Okay, another little story here. So Jade, you be Muhammad, I'll be the receptionist.
Okay. Ali sprains his ankle. Please, can we have an urgent appointment with the doctor?
Yes, what is the matter?
My son Ali has had a bad fall. I'm not sure if he has broken his leg.
Okay, so now we've got a doctor one. So we go back to that one. We'll do a little one there with just two people. So I will get Mariam Panahi. Are you here? Okay, Nazia, are you here? Nazia?
Yes, teacher, I am here.
Beautiful. Nazia, you can be Mohammed.
Yeah.
And Gulsum, are you here? Gulsum?
Yes, teacher, I'm here.
Okay, you can be the
Yes,
receptionist.
I'm here.
Okay, go.
Please, can we
Thank you.
have an urgent appointment with the doctor?
Yes, what's the matter?
My son Ali has had a bad fall. I am not sure if he has broken his leg.
Okay, so this is an interesting one because Mohammed wants to have an urgent appointment because something very sudden and bad has happened to his son. He had a fall, a very bad fall, and the leg is very painful, and Mohammed doesn't know if it's broken. So the word urgent means, can we have it straight away, quickly? We want it now, that appointment. Okay? That's what it means. All right. So now we're going to do a Dr. Ali one. So, Jade, you be the doctor.
Okay. Hi, Ali. What's wrong with your leg?
I fell hard on it at football.
Is it very painful?
Yes, my ankle is very sore.
May I examine your leg?
Yes, of course.
Luckily, I don't think you've broken anything, but you have sprained your ankle very badly. It's very swollen and bruised. I will strap it and give your dad a prescription for some medicine. Mohammed, you will need to go to the chemist and get this script filled. I think that's it.
That's it. So, yeah, we'll stay with this one and I will get two people. So, Tahira, are you here? Tahira? Sarah Pashtunia, are you here? Sarah?
Yes, Mama, I'm here.
Okay, Sarah, can you be the doctor? Fatima
Okay.
Gulami, are you here?
Yes, Mom, I'm here.
Lovely, you can be Ali. Thank you. Go.
Okay.
Okay, start, Sarah.
Hi, Ali. What's wrong with your leg?
I feel hard on it at football.
It is very painful.
Yes, my ankle is very sore.
May I examine your leg?
Yes, of course.
Luckily, I don't think you have broken anything, but you have sprained your ankle with badly. It's very swollen and bruised. I will strap it and give your dad a prescription for some medicine. Mohammed, you will need to go to Chismet and get this script filled.
Okay, so very good attempt at reading and lots of big words. So I'm going to get you to go back and let's go through some words here, okay? So most of this was fine, but we have sprained the ankle. So Fatima, can I get you to say sprained?
Sprained.
Okay, can I get you to, and then I want you to say bruised? Bruised?
Bruised.
Bruised. That's right. It's a very funny
Bruised.
word. Now we have a word here called prescription.
Prescription.
Beautiful. And the prescription is what the doctor gives, like a piece of paper. See, the doctor is writing on the paper here about
Give
the
it.
medicine. Yeah. Okay.
Yes. Yes.
And then he has to go to the chemist. Can we say chemist?
Chemist.
Beautiful. Excellent. All right. So next one. Now they are at the chemist. Now, sometimes we call it a pharmacy. Sometimes in Australia, we call it a chemist. Okay? So the person who works in the pharmacy or the chemist might be we sometimes call the pharmacist. They make the medicines and get them ready for us, or the chemist. Okay. So, Jade, you be the pharmacist, I'll be Muhammad.
At the pharmacy, chemist. Can I help you?
Here is a prescription from the doctor.
It will take about 10 minutes to fill this script.
Thank you. 10 minutes later.
Your script is ready. Please take this medicine to the counter to pay for it.
Okay, so we're going to get two people to read this. Now, when they say to fill the script, it means that they're just going to make the medicine and then call you back. So often it takes a few minutes for them to get the medicine ready for you. That's called filling the script. Script is a short word for prescription, where Jade is doing that lovely thing there, so you can see there. Okay, so we will have Elaha. Elaha, are you here? Rosé?
I'm here.
Thank you.
So sorry,
Okay.
Mom.
Yep. Elaha,
I'm here. Can I read?
Elaha Rosé, you can be the pharmacist, right?
Okay.
Okay. Madia, are you here, Madia?
Yes.
Madia,
Yes,
can you
yes,
be Muhammad? You are Muhammad.
Okay.
Should I start?
Yep.
At the pharmacy chemist. Can I help you?
Here's a prescription from the doctor.
It will take about 10 minutes to follow this script.
Thank you.
10 minutes later, your script is ready. Please check this medicine to the counter to pay for it.
Okay, good. So now we can see what happens at the chemist. We get the medicine, then we take the medicine to the counter, which is where they have the checkout, and you pay, and then the lady will give you the medicine. All right? Okay. So we go to the next one. Okay. So at the pharmacy or the chemist, we can get lots of different things. So we can get all these kind of what we call lozenges, which are like sort of like they're like sweets, like they sort of taste sweet and hard and quite nice, but they are for when you have your throat is painful. So inside your neck is your throat that can get very painful if you have an infection. And you might suck some of these lozenges. Strepsils is a very common one. And then on the other side, lots of different vitamins for different things. Different things that might be wrong with your body, and you take vitamin B or C or D or whatever it might be. So these are all the different vitamins at the chemist. Okay, next picture. And we can also get antihistamines, a big word, antihistamines, for allergies. So if you touch something or you eat something, you get a rash, itchy on your body, or you might feel like you're going to faint, you might have an allergy, and you might take one of these, or sometimes your nose can get very blocked and you can't breathe. You might take one of these, Claritine, Telfast. These are called antihistamines. They help allergies. And here are the medications that are good for children, because children, small children, can't have the same medication as adults. So we have kids' cold medicine, kids' travel medicine, different types of cough mixture, like for the children. Okay? So they're the medications for children, suitable for children. Okay, we go to the next one. All right, let's go with Maisie. Maisie has an allergy now. That's the other family, not the Ahmadi family, but the Button family.
Button Smith.
Yeah, whatever. Button Smith family. You are right, Jade. You are quite correct. Okay, I will be Jack, you be Maisie. So Maisie has an allergy. So Jack is the dad. Why are you scratching your arm, Maisie?
It's really itchy.
Let me have a look at it. Oh, you have a rash all over your arms and hands. your eyes are a bit swollen as well.
It happened after I touched that hairy plant on our walk.
You have an allergy to that plant. This is definitely an allergic reaction. I'll go to the pharmacy and get some antihistamines for you. Okay, so here's poor Maisie, and we'll get two people to read. So the two people will be Shukriya. Are you here? Shukriya Amiri?
Yeah,
Okay.
Miss.
Oh, hello. Okay, you can be Jack.
Hello.
Mina, are you here, Mina?
Yes, ma'am, I'm here.
All right, you can be Maisie. Off you go. So Maisie has an allergy. Start. Shukriya.
Okay. Why are you scratching your arm, Macy?
It's really itchy.
Okay, let me have a look at it. Oh, you have a rash all over your arms and hands. Your eyes are a bit swollen as well.
It happened after I touched the hairy plant on our walk.
You have an allergy to that plant. This is definitely an allergic reaction. I will go to the pharmacy and get some in what's that for you? I don't know there
Antihistamines.
is the word.
Antihistamine. Can you say that?
Antihistamines.
Yeah, if you just take it bit by bit, you can see it. Anti, his, ta, means. It's a funny word, long word.
Okay.
Yep, but good try.
Yeah.
Yeah. Okay, so here we have Maisie has an allergy. Good reading, both of you. Very hard word there, so good try. Okay, next one. All right, so here are some common medications, right? So we have like different medications here that you can see. So I'm going to leave you to look at those and I'll read you the little sentences. Fatima has a headache and fever. Hugo has a rash. Mariam was coughing all night. Lisa has a blocked nose and sore throat. Now, I'm going to ask someone here. Nadia, are you here, Nadia? Okay.
Yes, teacher, I'm here.
All right, my dear. Nadia, can you match the sentences to the medicine?
Okay. Fatima has a headache and fever. It's number 4. And Hugo has a rash. I think it's number 1. No, it's number 3. Mariam was coughing all night. This is number 1. And Lisa has a blocked nose and sore throat. It's number 2.
Number?
2.
Okay, let's look at number 2. That is an antihistamine. Remember when Maisie had the itchy rash? Like on her arm? See this allergy, the word allergy here? So do you think that would match with Hugo has a rash or Lisa has a blocked nose? Like when you have a blocked nose, it's like when you have a cold. You know, when you get sick with COVID or flu, you get a cold. So which one do you think? Hugo has a rash. Which one is it matching to?
Number 2 is rash.
Number 2 is rash.
Number 2 is rash. Good. And Lisa has a blocked nose is number?
3.
Beautiful. And do you students have Vicks in your country? Where is that very strong smell, like a menthol, very strong, like a
Yes,
peppermint.
ma'am.
Yeah? Then you
Yes,
put and you
ma'am. We
can
do have.
breathe. Huh? Good. Thank
We
you
do
for
have
telling
this
me.
weeks.
Thank you. Yeah, I thought you had Vicks because I heard from someone else you have Vicks. Excellent. Okay, let's go to the next one.
I was just going to butt in and say that Lisa has a blocked nose. That could be from an allergy, but it doesn't usually go with a sore throat. So you weren't
Yeah.
that far. Yeah.
Yeah, so that's a good one. Yeah, true.
Yeah.
So sometimes when people are very sick or injured, or they've broken their arm, that's when you're injured. You might have a cut or a wound or a burn. Or if you're sick, you have a cold or you are feeling you have gastro or something like that. we can say these phrases in English. So if you know a friend that is sick, you might say, I hope you feel better soon, or get well soon. And sometimes we can give them a card or something. Depends how sick they are. Like for normal sickness, we don't bother too much. But these are nice things to say to someone. If you know someone says, oh, I'm really feeling very sick, I have a cold. And you might go, oh, I hope you feel better soon, or get well soon. Okay? So they're just good ones. Okay, next one. Jenny is unwell. So let's go with Fatima and Jenny. I'll be Fatima, you be Jenny. Jade, please. And Jenny is unwell. Unwell means that you are a bit sick. Not very sick, but a bit sick. Okay? Bit under the weather, as we might say. Okay. Hi, Jenny. Would you like to come over for tea tomorrow?
I would love to have tea with you, but I have a bad cold. I wouldn't like to give it to you.
I'm sorry to hear that. I hope you feel better soon. Stay warm and have lots of hot drinks. All right, so I'm going to get 2 people to be here. Nasima, are you here, Nasima? Nasima, are you
Yes.
here?
Yes, ma'am, I'm here.
Hello, you can be Fatima. And,
Okay, ma'am.
okay, and Nagas, are you here? Okay, if you are not here, I'm going back to Farzana. Farzana, are you here?
Yes, ma'am, I'm here.
All right, my love, you can be Jenny. Okay, so Fatima, you are Nasima, and you could, Farzana, you can be Jenny. Okay, go.
Okay, ma'am, thanks. Hi, Jenny. Would you like to come over for tea tomorrow?
I would love to have tea with you, but I have a bad cold. I wouldn't like to give it to you.
I'm sorry to hear that. I hope you feel better soon. Stay warm and have lots of hot drinks.
Really good and lovely expression from, I think it was Nasima who was Fatima. Good work. But both of you, very good. Okay, so I might go right back to those early slides, Jade, if possible, because we have a few minutes and they could do practice saying some of these useful words and phrases. So let's go with, I am going to go back and ask, let's see who has their hands up. Okay. Soraya Sultani. Soraya, are you here or not? I see you have your hand up. Not sure why.
Here. Yeah.
Okay, beautiful, Soraya. Can you, I think, did we read through these ones? I think we might have read through, no, not these ones. Okay, go, read.
Read this word.
Yeah, read the words.
Yeah. And
Soraya.
doctor, general practitioner, and a dentist, optometrist, and a nurse, hospital, clinic, medical center, appointment, chemist, pharmacy, and prescription.
Okay, good. Let's just go back to practitioner. Can you say practitioner?
Practitioner. Practitioner.
Yeah, good. In Australia, we usually just say GP, right? But that's okay. An
Yeah.
optometrist. Can you say optometrist?
Optometrist.
Optometrist.
Yeah, optometrist.
Almost right. Okay, I'll give that one to you. Let's go with the next slide.
Yeah, the accent is on the Tom.
Yeah.
Anyway.
Yeah.
Okay, let's go with the next one. Nagaran. Nagaran Afghan. Go for say.
Yes,
I want
ma'am.
you to say these words. Go.
Okay, ma'am. The first one is sickness or disease. Second one is injury, to suffer from, to be treated, medicine, drug or medication, advice, vaccination, injection or shot, blood test.
Beautiful. Nice reading. Good. Okay. So the next one I'll get the person to read would be Homera. Homera?
Yes, ma'am. Yeah.
Okay, go.
Pain, painful, sore, ache, aching, tablets,
pills, vitamin, cream, ointment, cough mixture, um, lozenges.
Lozenges. Good. That's a hard word. Good. Good try. Okay. We'll go to the next one. Okay, naming parts of the body. I think we'll go to there. I look. I think Mastora. Are you here? Nope. Sumaya, go. Sumaya Mohammadi.
Okay, ma'am. Okay.
Yeah.
Naming parts of body. Parts of the body: head, neck, shoulder, chest, stomach, elbow, arm, hand, finger, um, fingernail, knee, toenail,
Okay. What
and
about this? Yep.
hand, thigh leg, calf leg, heel, foot.
Okay. So there were one or two that we had a problem with. So stomach. Can you say stomach?
Stomach.
Perfect. And
Stomach.
thigh. Thigh. You don't need to say thigh leg. It's just part of the leg, but the top part of the leg is thigh.
It's
Can you say thigh?
thigh.
Beautiful.
Thigh.
Good work. Okay. So what's the next picture? And we'll just check. Okay. I think we did have someone do these ones. So I think we are probably right towards the end of the lesson. So if you want to do your last couple of slides, you
Yeah.
can.
Did you want to do the preparation for next week's
Yeah.
class?
So next week, I want you to just go through the words and all of the phrases to do with health and sickness. They are very important because if you come to an English speaking country or you have to engage with an English speaking doctor, these words are very important. Practice pronouncing the words like stomach, prescription, concussion, diarrhea, gastroenteritis. There's lots of hard words. Okay, whoever's got mic on, put it off. Compare a pharmacy or a chemist in your country with one in Australia. You can see some of the pictures in our lesson. And also, I just was wondering what you would say. So when I said when people are sick in an English-speaking country like Australia, we would say get well soon or hope you feel better soon. What would you say in your language to a person who is sick or injured? Would it be the same thing? I want you to think about that and tell me what you would do. And so that's your preparation. Okay.
I'm just going to skip right to the last question, which was a hard question. So I'll ask for anyone who actually read this and thought about it. Have you read this yet, Nikki?
Nope.
Because I'm being really mean to you.
Also, if anyone
so
is
mean
going
to
to
you.
get this wrong, it's going to be me.
I know.
So you
I
could
know.
shush up now. All right,
Yeah.
go.
Okay, so Nikki and Jade, so you're using the information that is on the schedule, the departure schedule, to answer this question. Nikki and Jade are both flying to Bali. They are running late for their flights. Nikki is flying with Virgin Australia and Jade is flying with Garuda Indonesia. Who missed their flight? I'm making fun of Nikki because Nikki prefers Virgin to Garuda. So
Actually, I love Garuda because you get really good Indonesian food. Plus, I can speak Indonesian on a Garuda flight and eat those amazing Indonesian peanuts. So,
okay.
hello.
I'm wrong. I'm wrong. I should have made.
Although I do love, I do go to I do go a lot on Virgin. Okay,
Okay.
so
who
like,
knows the answer to
we've
this?
got some hands up. So
Yep.
we've got 4 people with their hands up here. Where are they? I can't see them now.
I've got Sultana,
Yeah,
Madia,
yeah.
Mina. I don't think Mina's had only one
No, Mina
go.
has had, everyone's had. It's all
No,
good. So you
one
can
go. But
ask.
she's only had one go, I think.
Yeah,
right?
she's read a dialogue though. So you can choose whatever you want. Choose one of
Oh, it
them.
doesn't matter. Yeah.
Yeah, choose Mina.
Mina, can you explain the answer to this question? First of all, the answer is just who. So you can just give us one name, Niki or Jade. Mina, do you want to answer this?
Yes, ma'am. Just let me to just read and answer the question, okay?
No, I think we'll go to Madia first. So the idea was you put up your hands if you've already worked out the answer.
Yeah. So Madia?
Madia, do you know the answer?
She's trying to manipulate you.
Elaha, you've got can you turn your mic off, please?
Yes.
Elaha, can you turn your mic off? Thank you. Madia, do you want to answer it? Soraya, do you want to answer it?
Yes, I want to.
Great.
And
Good on
Nikki
you.
is replying.
Nikki's good. That is the correct answer. But now, can you tell us how you work that out?
Um, because
Do you know what? Soraya, your internet is going in and out, so we can't hear you very well.
Australia flight attendant is closed. Teacher?
That's okay.
Yes.
Okay.
Yeah. Who wanted to answer? Sorry, who was the other one?
Okay. Well, Jade, do you want to tell
Soraya,
them
you did a
why?
good job. Yeah. I'm going to put
Because
the
we're
answers
over
up
time.
on the
Yeah.
Okay, so the answer, you want to find out what sort of information would you tell you whether they'd missed their flight. And so if you look at all of the information here, you can see under status, there are some closed gates. If they're closed, you can't go in. Then you come down here to find the name of the airline. Yep. But more importantly, you have to look here for Bali. So there's two for Bali. One is Virgin, one is Garuda, Indonesia. And so Nikki, who's going with Virgin, missed her flight. Poor Nikki.
Yeah, guess who wrote this question? Huh, right. As if I wouldn't be going on Garuda. But anyway, that's okay, everyone. Anyway, thank you guys. You guys